Hello and welcome to this IDS webinar. This is one of Danielle's special calls, or consulting calls. And in this audio recording with a staff member, and actually with a couple of staff members, she talks about solving problems collecting prepays without upsetting the patient, tackling barriers to acceptance of treatment, and finally on handling angry patients. Enjoy it.
So the other thing that you had on there was exceptions.
Oh, yes. So, exceptions. That one I'm working on. I know that hopefully I won't screw it up anytime soon because we just talked about it at work. But doing exceptions, one thing I've noticed is, we try not to go outside of the policies. And every so often there'll be an exception made. And it'll happen a few times, and I'm like, oh, well, it's okay. We've done it several times. So I just, I kind of get to assuming that it's okay. And so then I'll make an exception for a patient.
Okay.
And then it backfires.
Yes.
They end up canceling or something happens, and I'm like, oh, my gosh, here I made an exception. And so we're working on no exceptions, especially when it comes to treatment planning, scheduling, collections or anything like that.
Well, I mean, you're right in the way of, no exceptions is the best way. You made these policies for a reason because you got burned, and so you're preventing it from happening again. So if you do need to make an exception here, if we have to make an exception, we don't do them on our own. We consult with each other so that the other person can either remind us or give us a good idea. So, for example, we have payments paid in full 2 weeks before surgical dates, and that's our policy. Now, if somebody says, I've spoke to my bank, they can't get me a check until this date, and that date happens to be 3 days before the surgery. So, of course, that's not our policy. But if I say, no, I'm sorry, that's not our policy, we can't do that, it's $23,000. It's a lot of money. I'm not going to say, nope, I'm sorry, that's our policy, we can't do it. The guy's going to be like, okay, well, forget it, I'm just going to take my money and go elsewhere because I can see where it would cause some upset. So I can either A, move out the surgery so that it's 2 weeks, or I can B, exactly, they're going to think it's all about money. Or I can say, you know what, let me just go talk to my manager for a second, go talk to me, listen, this is what's going on. I can look at it and go, all right, well, he's gone to his bank. He's talked to his bank. It's a done deal thing. He's going to have the money. Okay, well, tell him I need him to come in on that date with the check in order for us to confirm. If he cannot have the check that day, then I need him, of course, I need to have a talk with him on the phone and find out what's going on. And I will handle it from that point on to say, okay, when can we have the money? Okay, end of the day today? Okay, let's do it. And there's going to be somebody making sure it's there. So, yes, you can make exceptions, but be sure that you guys are consulting with management, consulting with each other, consulting with the doctor, and be sure that it's not something like, well, I can't have it by 2 weeks, I'll have it to you as soon as possible. Well, you need to have a date. It needs to be paid by the 23rd, by the end of the day, or we may have to move your surgery, or, whatever it is. So I think to say no exceptions is a great idea, but it's just not going to happen. Things happen with patients.
Right, well, because things do. The last exception I did, and it wasn't like it was bad or anything, the patient had paid in full for his surgery, and then he had something come up and he couldn't make the surgical date. And he knew about the surgical cancellation fee. I told him about it, and he said, that's absolutely fine. And he goes, I can't do that right now, though. I have to get going. And I was like, you know what? No worries. We'll get your next appointment. And so I made an exception because we always collect those cancellation fees over the phone or at that time. And he was in a really big hurry, and I'm like, you know what, that's okay. Thank you for calling. I'll get everything rescheduled. And he rescheduled that day, But then the front office didn't realize when he came in for a surgery that he, needed to pay $100 because when they charged out, he had a balance. And they're like, why does he have a balance? And I'm like, oh, he canceled.
Yes.
So.
Yeah, for things like that, like I said, you can make the exception, but you probably, instead of just saying, okay, no worries, just say, I understand. Can I give you a call tomorrow because I do have to collect this for the date? So actually having a date and time that you call to collect it so that you remembered, it's on your list, and he knows that you're going to be calling, and he expects your call, and you don't feel like that you're hounding him down for $100. You know what I mean? So it's probably
Right,
more of
and
the line of that.
Oh, and he had planned on paying it when he came in for his surgery. He's like,
Right.
I'll pay it when I come in, and I'm like, that's perfect. And then there was just a lack of follow-up on my end because I got busy. And I
Right.
knew he needed to do it. And so then when he came in for his post-op visit, I'm like, oh, and don't forget we have that balance on your account. And he was totally cool with it.
Right.
It was just the lack of communication, which is my other one. Sometimes I think that, when people open up things, they're automatically going to see what I see or what the doctor sees.
Right.
And I think just getting in my head that everybody sees things and hears things differently.
Right.
So,
now, whenever we have a
doctor's
patient
like,
that's
assuming.
yeah, you're right. Now, for you, coming in, it's a less convenience for the patient to just pay when they're coming in. I understand that. And again, you don't want to be all about money. You want to not seem like that. If we have a patient that's agreeing or we've made arrangements for that patient to pay something when they come in that day, it's not something that we typically do. It's completely out of our normal, but it happens at least once a week. We have arranged with the patient to pay something when they come in. Now, I have to now depend on my front desk person to know that or to remember that because I'm going to be in surgery. So the rule that we have is on the face of the schedule where it says John Doe, post-op 1 check, it says collect $500 today on the face of the schedule. So when my receptionist is checking him in to notify that he's there, she's reading that, she's looking at that, and she's going, oh, John, yes, I see here that Michelle said you were going to bring $500. Oh, yeah. And so she collects it. So I'll have in my notes, collect $500 today for balance of surgery. Patient knows to pay it. Please ask when they check in. So it's on the
that works really well. We started putting in the fees for the appointments when patients come in, like PMT days or pre-op days. And that was definitely something that I could have done for her, was put that in the actual appointment, collect for cancellation fee.
So that's
because sometimes I think when it's staring you in your face instead of having a general alert that only pops up when you open up the patient screen or something is a lot better because you're staring at it all day.
You're right. You're absolutely right. And so a lot of the problems that you're having, Michelle, is just not being able to complete your cycles of action. You have great intentions on getting back to it or doing it, and then you get distracted by work, by things that are happening, and then you just forget. So if you would have wrote down on your to-do list, make sure I put on the schedule, John's paying $500 when he comes in. Then by the end of the day, you go, oh, gosh, I got to put that on the schedule, and you would have had that in there because you're keeping too much in your head as your day goes on.
I agree. My head is very full.
Yes. You do a lot at the office. You do a lot at home. And, yes, that's what females do. That's what moms do. But it bites us in the butt because we just can't keep up with it. So keep that piece of paper in your pocket. Keep adding this stuff to it. And when you have some time, everything is right there on that piece of paper. It may not be pretty. It may not be in order. But you can you can finish all your cycles, put it all back together again, and then go back to work.
Yeah, I think that is a great idea because you're right. Sometimes it's impossible to complete a cycle of action that you started because you never know what's going to happen.
You're right.
So.
Someone's beeping you in for surgery. Doctor has an emergency. You're running around. You're trying to turn around a sterile lab because you have no instruments. Things happen that you can't just say, I'll be in there in a minute. I'm going to put this note in. You can't say that. You can't do that. You're running. You got to be there.
Oh, that's what I've been. I told the doctor, hang on, I'll be there in a minute. I got to finish my progress
note. Yes.
It's like progress note got to go in right now. And because I would, and I try to send myself 15 notes. Don't forget this progress note. And you're right.
That's the stuff that goes on your list. And when you do have, okay, I'm all caught up, sit down, that progress note, that transaction, that alert, putting it on the face of the schedule, whatever it is, put all that stuff into effect.
I like it. I think I'll do that.
Good. Perfect. Angry and unlistening patients. That's my favorite one. So, Sierra, what is it that you do at the office? What is your job?
So I am the receptionist at the front. I greet patients. I handle money intake. And something that we do tend to come across is since we've recently become out of network and out of assignment, we have had to collect more from the patient, and that has definitely thrown them off.
Right.
And they can kind of, build themselves up a little bit and get angry. And I just want to know, what are some good tips to handle them when they get to that point?
All right. So the anger and frustration takes place when you are asking to collect an X amount of money, correct?
Yeah.
So is this happening more so with treatment or cleanings or just both?
It's more so with cleanings, because with any type of surgical procedures, Michelle, we usually talk with them.
Right.
She's our surgical assistant. She'll explain everything, and then it kind of makes a little more sense to them because it's a surgery.
Right. Right.
But explaining to them that, that our fees haven't changed, like it's just us billing you entirely and not billing the insurance, it's hard for them to understand that
right.
the amount is not us just collecting more.
Right. So you are not collecting full fee and resubmitting for reimbursement. You're just collecting what the insurance company is not covering. Is that correct?
We collect for all of it. We collect the total fee from the patient.
Right.
We bill the insurance, and the insurance sends the check to the patient.
So that you're just doing the pay up front, reimburse.
Yep.
That's what we do too. We do the same thing. So you're collecting. How much is your cleaning?
A peri-maintenance with an exam is usually $415.
Did you say $415?
Yep.
Okay. So $415 when they come up, you're asking the amount, and then they have a little heart attack and say, "Oh my gosh, that's crazy!" And why isn't my insurance covering this? And why, that sort of thing, right?
Yeah.
Okay, so like I said, we do the same thing. We're not a provider for any insurance, so we actually battle with that on a daily basis. And we're hiring a new receptionist, and the biggest part of training her is they're going to yell at you, they're going to get upset, they're going to say, "Why is your fees always going up?" and so on and so on. And they're not going up. The fees aren't going up. They just either they're ready to fight when they come in, or they don't remember what it was the last time. But if our fees have gone up, it's literally a few dollars. It's not a big amount. So the way we do that is we put it back on the insurance company. And if they say something like, "That much money, oh my God, why do your fees keep going up? Why is it so expensive?" Our fees actually have not gone up, but X amount of dollars in the last 2 years. When if I say that's $13, our fees have actually only gone up $13 in the past 2 years. But you know what? The insurance companies are just getting so difficult. That's why I'm going to send for a reimbursement today, and whatever it is that your insurance company is going to reimburse you, they're going to send you that check. So yeah, our fees haven't gone up. I know it's a pain. It's so frustrating. I know, but that's why we haven't raised our fees in X amount of time. So I kind of match their little angry frustration, but not towards us. I'm not going to say sorry.
Redirect it. Yeah.
Yeah. The moment you say sorry and I'm so sorry. I know. They feed off of that, and they actually get angrier. So you have to match that tone, but it's kind of like a friend coming to you complaining about another friend, but they're mad. You have to be like, "My gosh, I understand that. That's horrible. My gosh." Same kind of thing. They want to make sure that you understand what it is that they're griping about, and after I do that, they really don't have anything else to say but to continue to get disgusted about the insurance. And usually that conversation will start to evolve around, "Yeah, you know what? And why hasn't the dental insurance become like part of the medical insurance? I mean, you have to have a stable bite, and you have to have good teeth to eat, or how do they think all these medical problems begin with?" So you have to turn that around with them every time.
Gotcha. Okay.
So really, you and whomever, you guys just kind of maybe bounce off of each other. One's an angry patient, and you guys know the scenarios. It's the same thing almost every time. You probably have 3 different scenarios that happen every single day. You guys really should just prepare for those and just practice how to handle them, because they're really looking for you to be confident. They're looking for you to have a really good answer, or they just keep getting frustrated and they have nobody else to yell at but you. You're standing right in front of them.
Yeah. We had the issue of some people just being like, I wasn't prepared to pay this today. Like, I can't pay this. And we were left with not really being sure how to proceed, because we always tell patients if they are going to do a period maintenance here at this office, what the fees are ahead of time. So it's never a surprise.
Right.
So we're not really sure how to really make them prepared that they're going to have to pay it.
Right. Well, you can, like you said, preparing them is good. You can either prepare them on a reminder letter or reminder postcard, which we do a lot. It has their appointment, time, date, and you can have their amount, due on there. That way they call with any frustrations, but they're prepared. Or, when they come in, you can also say things like, get excited about care credit, for example. You know what a lot of our patients do? They love this care credit because they have a 12-month interest-free. So as long as you pay it by 12 months, there's no interest, but you can make payments. So you can actually, I can run care credit for you now, see what you're approved for. And if you're approved for like $1,000 or whatever, you don't have to use that. But you can always use that for your cleanings, or if you have anything else done at another office, you can use it. But the great thing with care credit that I like to say in my selling of it is at the end of the year, you can just go onto their website and download what you've used on care credit for the year, and you can take that right to your accountant for tax purposes. It's all right there. It's like budgeting for your dental medical stuff. So it's a great thing to have. So I kind of just really use that as a great tool that patients like. And if they don't want to do that, you can always just say, what can you pay today? And I can, bill you the rest, and you can pay that within 30 days. But, we're an upfront pay office. We don't allow that, but if you have to, you have to. Get what you can before they walk out, and try to see if you can collect the rest later. But the care credit is the one that patients usually jump on pretty quickly.
Gotcha. Okay. We've had people who said that they just can't do like financing options at all.
Yeah.
And I'm not sure how to approach those patients with pain, because it's really important that they do care. And we do try to stress that here at this office, that you need to take care of yourself and your teeth. It's really important to look after that. And, coming here is always the first step, making that visit is always the first step to just at least being here and getting that exam.
You're right.
But the follow through is hard to get patients to go past that first exam. They see the big number, and then they think that they can't do financing options, even though we tell them, like, we have them here. You can check right now, right here, right now, to see if you can do it. And they're just like, well, we'll just save the money. We'll just save the money. And we never hear from them again.
Yeah. Well, why are they afraid to finance?
They have not usually told us. We've spoken with, I think, 3 patients, especially recently, that if they just can't do financing, they just don't want to pay and do financing. And
do they know? Yeah. Do they know it's interest free?
We tell that. We always go for care credit because we have patients that come to us because we do care credit. And yet, even with the year of no interest, they still are saying they can't do it.
Okay. Yeah, I really sell the no interest, because I tell them, I said, even with people that have the money in their pocket, choose the care credit interest free, because it's free money. You don't have to take all your money and lay it on the table. You can just pay the payments. Now, do you also offer prepaid discounts?
We do the 5% if they pay in full.
Good. Okay. And the only other thing that we have done is they can make in-office payments for stuff, but it's prepayment. So, for example, if someone says, I have a hard time paying for my 2 cleanings a year, it's X amount of dollars, I don't have that much money and I can't get financed, they can pay the office money a month, like, $50 a month, $100 a month, or whatever it is, and I can keep putting it on their account, and when they have enough money for a cleaning, they can come have a cleaning. It's just prepaying. So I've done that for cleanings, and I've done that for treatment. Someone who has a $5,000 treatment plan and they don't have the money, they can pay $1,000 a month, and when they get to $5,000, then we'll do the treatment. So if those people usually make the money, but they don't claim the money, so they can't get financed.
Okay, gotcha.
So the other question that you had was explaining to patients the value of treatment and when insurance is not in the picture. So what problems do you have now with explaining the value of treatment? Where's your hang up there?
So the troubles that I usually have are they'll be back with Dr. and Michelle, they'll have their exam, they're just saying, yes, doctor, totally makes sense, okay, sounds good, and then they transition up to me, and I'm like, great, I got to talk with Dr. Drake, I see right here, this is your treatment plan, I see that Michelle has gone over Care Credit with you, are you interested in doing Care Credit? And I try to get them scheduled, and then I hit the roadblock of them with them saying, oh, well, I can't do that. I had this visit. Just call me back later. It doesn't seem that what is happening in the exam room is sticking outside of it.
Okay. A few things that I do to prevent that is I've expressed that issue to Dr. Sheldon that, whether they just want to make you happy or if they understand in the presence of a doctor, but they're always ready for treatment until I get them and then they're ready to go home. So what I've asked him to do is when he's presenting the options, ask them which option is more appealing to them. Let them say, the implant, great. When do you think you could get this started because because that tooth is very infected, I want to get it out soon, because that space is closing, I don't want to wait too long, and for the doctor to place some sort of urgency, whatever urgency they can find on it, so that when they bring the patient to me, Michelle or Dr. Drake can say, Jane Doe needs to be scheduled for this implant treatment, and I've discussed it with her, and she knows that we're going to find something as soon as possible, so that that's being relayed, and the patient knows it's being relayed, and so it helps me out a little bit more with that. Okay. So that's one thing I recommend. There's always some sense of urgency that can be found on treatment. Whatever it is, there's something, at least capturing what plan they'd like to do. And even if they're just excited about it, I'm going to let Sierra know, listen, you're really excited about this, and we're excited for you, and we want to get this ball rolling as soon as possible. So I'm going to have her find the soonest available appointment that I can find. So it's something where you have something to work with. Well, Michelle said that we got to get you in here as soon as possible, and you're kind of working with that. As far as showing the value, before I start talking of money and all that such, and I know that you guys have seen the videos, I always put whatever plan it is that they've chosen, I bring out those models, I show them the implant, I show them the crown, I go over, okay, day one, when you come in, we're going to be doing this, this, and this. When you come on the day of surgery, we're going to be doing this, this, and this. Then when you go home, you're going to be, recommend that you stay home for 1 to 2 days, take care of that. Then in 3 months, when you come back, we're going to have this. And so I kind of color the entire picture for them before I try to get them on the schedule, before I collect the money or ask for the money. I want to paint the picture of what they're going to get. And when you get that crown, it's going to be strong and beautiful and independent. You can floss in there. See, right here is the crown. So with that in mind, the first day you come back, we are going to be doing, the extraction implant. That is going to be about 3 hours of your day. I would recommend that you have a driver. You're going to go home that day. You're just going to rest that day, take it easy. So what day would work out better for you with that, so that they can start thinking, not scheduling an appointment to to do something they're paying for, but to prepare for that surgical event. So they're starting to think more clinical now. So that's always worked for me because, of course, you're making it sound official and you're making it sound important, and that always helps me.
Yeah, and then they have that image of their mind of what's going to happen, and then it's not just a bunch of zeros they're getting.
Right. And with insurance and that, when I start to present the fees and they start saying, but I have insurance, and what is insurance going to? Well, this is the way insurance works with dental. It's not like medical insurance. This is the way it works for dental. We cannot submit a claim until you've had the work done. So there's nothing we can do at this point. We need to wait until the surgery is done. The day that you have your surgery done, the doctor is going to dictate a letter. We're going to send the x-rays. We're going to send all the information to the insurance company and let them know what was done, why it was done, and how much was paid for the procedure. Then whatever your insurance company covers in your plan, they're going to reimburse you that money. They're going to send that check to you to your home. So that's how the insurance works. And for your insurance, what is your maximum? $1,000, $1,500 a year? Okay. And they'll usually tell me, okay, so, you'll, with this plan, you're most likely going to be able to get, maximize your reimbursement. If you don't do it here, you're going to do it at your general dentist office because he's got to do an abutment, he's got to do a crown. So one way or another, between the two of us, you're going to be able to maximize your return. Again, in confidence, you do this all day long. They need to know you know the way it works, you understand the questions, but this is just the way it is. But the most important thing is that they're getting it done, because if you think this is expensive, just wait until you hold off for 2 years and do it. Then you have a super erupted tooth and you have something else going on. So the best thing to do is just take care of this. Did you have anything else that you wanted to cover?
I think I had only one other thing, which was I wanted to know, as far as training new staff goes, specifically another receptionist, what tips would you have as far as having them go through the procedures and kind of showing them the ropes?
Well, for our typical way of training that we have felt is most effective is usually the first week that someone is joining our practice. We have them doing small stuff, but mostly observing. And now what I tell them is I want you to look at how the staff treat each other, and I want you to look at how the staff treats the patients. I want you to really understand our standards. Understand what we do to get a patient in, what we do to get a patient out. Our flow of the day, I really want you to take that in. So I want you to really take note to that. How many times does the phone ring? How are we on the phone? How do we communicate with each other? And I'm showing them our standards. I'm showing them the way our flow goes. So they understand the communication center. They understand that when someone gives you a note or an email, you have to respond to that by the end of the day. That acknowledgments, how we do our staff meetings, because we do ours once a week, so they'll experience a staff meeting. The entire methodology on how we run that practice during the week, I want them to take that in for the first week. The second week, we usually start them off on a training check sheet. So it's not a check sheet on how to master their position, but it's like the first step. So it's going to have probably like 13 things on there. They're going to learn how to check in and out a patient. They're going to learn how to notify an assistant that the patient is there. They're going to learn how to take care of the reception room. They're going to learn how to do mail in out. The stuff that's kind of basic stuff. So they have to, and I'll give them a time frame for that training check sheet, whether it's 4 weeks, 6 weeks, depending on what you have on there. What we have on ours is enough for 3 months. So in 3 months, they can answer a phone, they can redirect a phone, they can do messages, they can confirm phone call appointments. They have a lot of stuff on it they're going to master in 3 months. In 3 months, if they can get through that check sheet and be able to master those 13 items, which are pretty small, then we do an incentive for them. And we make them because it's their probation period, so then they're a permanent member of the staff. And then I give them a mastering check sheet, which is how to master their position. And they are supposed to get through that pretty quickly, meaning max another 3 months they can get through that. Now, of course, they're going to be slower, and of course, they're not going to be as confident, but they should be able to get through the mastering check sheet pretty quick because 3 months of being there already, they're pretty used to the systems. So the meaning of that, I give small doses because I don't want them to learn everything at once. I really want them to learn the ins and outs of everything that they're learning so that they understand why we do it that way. So I do give check sheets, and I tell them they're in charge of the check sheets. I'm not going to remind them to check things off, but I give them an expiration so they know on this date I'm going to be asking for this back, and this is pretty important to your employment in the practice. If you can complete this in 3 months, we can proceed.
Perfect. Okay. Yeah, we do have some checklists here, but I do feel that they may be a little too overwhelming. We just started making the checklist, so it's definitely going to need some finagling, a little bit of working back and forth.
I would divide it up on a training check sheet and then a mastering check sheet so that they feel accomplished and you guys don't get overwhelmed that they're not getting through it fast, because some of that stuff it takes some time to learn.
Yeah. I've been working here 2 years, and there's still stuff that I
absolutely
100%.
Yeah, absolutely. And I always start them first as the main reception area, which is checking in, checking out, mail in and out, reception room, and once they can do that, confirming calls and redirecting phone calls, then I can move them to scheduling, and then I can move them to different stuff in the office. But, I do start small because, like you said, it can get overwhelming, and you don't want to encourage errors by putting pressure on them. So start with small check sheets, let them master that. Great job, good job. Okay, next we're doing this, and let them feel like they're moving up the ladder and not getting stuck in a position.
Yeah. Okay, perfect. Well, thank you, Danyel.
You're very welcome. If you have any questions on that, if you try some stuff or you start to do it and you have questions, please email me. Let me know your hang-up, and I can definitely help walk you through it.
Yeah, thank you so much. I definitely will.
Perfect. Thank you. You have a great day.
You too.
Bye-bye.
We hope you enjoyed this video. If you have any questions, please email us. The IDS is here to help every dental specialty practice do better. I'm Dr. Lee Sheldon. See you on the next video.